Um, Assalamualaikum warahmatullahi wabarakatuh. So now in this video, we will talk about antibiotic resistance. Before that, we will introduce ourselves first. Next slide.
Hello everyone, my name is Kalisa Hanif Ervindra.
My name is Ibda Imuklisa.
My name is Zakira Latifa Zahra.
My name is Hana Laras Kinanti.
My name is Zed Ahmad Tahpilani.
My name is Rifdah Buya Harmaida.
And my name is Muhammad Abdul Aziz Hisham.
So in this video, we will talk about definition of antibiotic resistance, what causes antibiotic resistance, who is most at risk of getting antibiotic resistance, impact of people who's getting antibiotic resistance, and solution. Next slide.
Okay, what is antibiotic? Antibiotic is a type of medication designed to fight infections caused by bacteria. They work by either killing the bacteria outright or inhibiting their growth, allowing our immune systems to eliminate the infection. The term antibiotic comes from the Greek word anti, meaning against, and bias, meaning life. It refers to the role in combating harmful bacterial life forms. Antibiotics do not work against viruses, fungi, or parasites. This is common misconception we should all clarify. Antibiotics have been a cornerstone of healthcare since their discovery, with penicillin being the first widely used antibiotics discovered by Alexander Fleming in 1928. This discovery ushered in an area of unprecedented progress in medicine, enabling us to treat previously fatal infections like pneumonia, tuberculosis, and sepsis. However, while antibiotics are powerful tools, their misuse or overuse can lead to antibiotic resistance, a growing global health threat. Okay, next. So, what is antibiotic resistance? Antibiotic resistance occurs when bacteria change so that antibiotic medicines can kill them or stop their growth. As a result, bacterial infection become extremely difficult to treat. Antibiotic resistance is a type of antimicrobial resistance. Fungi, parasites, and viruses can also develop drug resistance. Your body doesn't develop antibiotic resistance, but bacteria do. When antibiotic resistance happens, fewer antibiotics are effective against a particular bacterium. Other antibiotics often help, but it's important to have as many treatment options available as possible. It's also important to begin effective treatment as quickly as possible for serious infection. If it takes longer for providers to find a medication that will treat an antibiotic-resistant infection, the outcome can be more serious. Antibiotic resistance is dangerous because it reduces treatment options for people who are sick. All right, the next slide will be explained by my friend.
Next is what causes antibiotic resistance. Antibiotic resistance happens when bacteria change and become stronger, making antibiotic less effective in treating infections. One of the causes is the overuse of antibiotics. This occurs when people take antibiotics too often or for a condition they can cure, like viral infections such as the common cold or flu. Antibiotics are only effective against bacterial infections, so using them inappropriately means bacteria get exposed to the medicine without being fully killed, giving them a chance to adapt and survive. Another cause is the misuse of antibiotics. This happens when people don't follow the doctor's instructions, such as not completing the full course of antibiotics or taking the wrong dose. When antibiotics are stopped early or taken incorrectly, some bacteria may survive and become resistant. Over time, this this resistant bacteria can spread to others, making infections harder to treat. As a result, the more antibiotics are overused or misused, the higher the chance of resistance, which can lead to more severe health problems and fewer treatment options for patients. Next point will be explained by my friend.
Okay, the third cause is spontaneous resistance. This form of resistance arises due to random genetic mutations in bacterial DNA. These mutations may occur during normal replication processes and occasionally result in changes that protect the bacteria from an antibiotic's action. The key features of spontaneous resistance includes the mechanism, which the mutations in genes encoding drug targets may reduce the antibiotic's ability to bind and inhibit its target. And it would increase expression of efflux pumps, which actively expel antibiotics from bacterial cells, and the mutations leading to decreased permeability of the bacterial cell membrane, which preventing antibiotic entry. And the next one, the fourth one, is transmitted resistance. This type of resistance is acquired through horizontal gene transfer, where resistant traits are shared between bacteria. This process allows even unrelated bacterial species to gain resistance genes, leading to widespread dissemination. The mechanisms of transmitted resistance include conjugation, which direct transfer of resistance genes via plasmids or small DNA molecules during physical contact between bacteria. And the next one is transformation, which uptake and incorporation of free DNA fragments containing resistance genes from the environment. And the third one is transduction, which is the transfer of resistant genes via bacteriophages, viruses that infect bacteria. And the next slide would be explained by my friend.
Next, who is most at risk of AR or antibiotic resistance?
Antibiotic resistance infections can affect anyone, but certain groups are at risk due to their health status or living environment. People more vulnerable to these types of dangerous infections include babies, adults over age 65, people experiencing homelessness, or living in crowded conditions. First is babies. Babies have immature immune system because babies' immune system are not fully developed, making them more prone to infections. This often leads to frequent antibiotic use to manage infections, even in cases where it might not be strictly necessary. Antibiotics during pregnancy or delivery. If the mother receives antibiotics during pregnancy or delivery, this can influence the baby's microbiome and potentially increase their risk of exposure to resistant bacteria. Second is adult over age 65. As people age, their immune system naturally weakens, making it harder to fight off infections. Older adults are more likely to develop infections such as urinary tract infections, pneumonia, or skin infections, leading to frequent antibiotics prescriptions. Many older adults have chronic conditions like diabetes, chronic obstructive pulmonary disease, or heart disease that make them more susceptible to infections. Last is homeless people or people who are experiencing crowded conditions.
Homeless shelters or other crowded living environments often have poor sanitation and limited hygiene facilities. These conditions facilitate the spread of infections and resistant bacteria such as resistant E. coli. Homeless individuals often delay seeking medical care due to financial, logistical, or systematic barriers. Poor nutrition and overall health weaken the immune system, making homeless individuals more susceptible to infections. And the next slide will be explained by my friend.
Okay, next, let's we talk about impact of antibiotic resistance. Resistance to even one antibiotic or antifungal drug can mean serious problems. For example, antimicrobial resistant infection that require the use of second and third line treatments can harm patients by causing serious side effects, such as organ failure and prolonged care and recovery, sometimes for months. Many medical advances are dependent on the ability to fight infection using antibiotic, including joint replacement, organ transplants, cancer therapy, and the treatment of chronic disease like diabetes, asthma, and rheumatoid arthritis. In some cases, antimicrobial resistant infection have no treatment options. Okay, next slide will be explained by my friend.
Okay, now we got to the solution or how to avoid antibiotic resistance. So healthcare provider and policymakers must do a good amount of the heavy lifting to change things on a global scale. But that doesn't mean that you are powerless. There's a lot of things that you can do to avoid antibiotic resistance. For example, the first one is practice good hygiene. Practicing good hygiene is essential for protecting yourself from infection, including bacterial infection that might require antibiotics. The more we use antibiotics as a society, the more the problem of antibiotics resistance can grow. One of the simplest yet most powerful hygiene practice is a regular and thorough hand washing. Washing your hand with soap and running water, especially before meals, after using restroom, and after coughing or sneezing, helps remove harmful germs and reduce the risk of antibiotic resistance. For the next point, will be explained by my friends.
Okay, besides practicing good hygiene, there are two other solutions, namely only taking antibiotics when you need them and getting the vaccines your healthcare provider recommends. Let's break this down in detail. First, we will look at only taking antibiotics when you need them. Antibiotics are powerful medicines, but they are not a cure-all. They are specifically designed to fight bacterial infections, not viral illnesses like colds or the flu. When antibiotics are taken unnecessarily, bacteria can learn to resist them, making the drugs less effective in the future. This resistance puts everyone at risk because it makes common infections harder to treat. The solution is straightforward. Only use antibiotics when they actually needed and prescribed by a healthcare professional. If your doctor prescribes antibiotics, take them exactly as directed. This means completing the entire course of treatment, even if you feel better before finishing the medication. It's also important never to save leftover antibiotics or use someone else's prescription. By following these practices, we reduce the unnecessary use of antibiotics and slow the spread of resistance. Next is the third solution, getting the vaccines your healthcare provider recommends. Vaccines are a preventive measures that stops infections before they even start. For example, vaccines like the flu shot, the pneumococcal vaccine, and other protects against disease that can lead to bacterial complications. By preventing these illnesses, we also reduce the need for antibiotics, which helps preserve their effectiveness. Vaccines work by training your immune system to recognize and fight off specific germs. This protection reduces your risk of severe infection and limits the spread of disease in your community. To make this work, it's essential to follow the vaccination schedule recommended by your healthcare provider. Whether it's routine childhood vaccines, annual flu shot, or other tailored to your age and health condition. Staying up to date is key to reducing antibiotic resistance. In conclusion, beyond practicing good hygiene, we can fight antibiotic resistance by focusing on two key solutions: using antibiotics only when necessary and staying up to date with vaccinations. Okay, next slide. For closing, we have a quote: always follow the advice of medical experts in using antibiotics. Next. Okay, to close this video, we apologize if there are any shortcomings from us. Thank you and wassalamualaikum warahmatullahi wabarakatuh.